webinar introducing the Professional Problem-Based Ethics, or ProBE program. ProBE is offered by CPEP, the Center for Personalized Education for Physicians in Denver, Colorado. My name is Dr. Catherine Caldecott, and I am ProBE's Program Director. ProBE is the original ethics remediation program for healthcare professionals whose licenses, practices, or training are in jeopardy due to ethical infractions. Developed in 1992, ProBE has assisted over 1,000 professionals and trainees from 16 different healthcare disciplines, including medicine, dentistry, physical therapy, chiropractic, and pharmacy. In this webinar, I will provide a brief description of the ProBE program, the ProBE philosophy, reasons why individuals are referred to ProBE, the nuts and bolts of how the program works, how a referral is made, the curriculum, the grading process, and what a referring entity can expect after an individual has completed the ProBE program. So, what is the ProBE program? It is a healthcare professional ethics remediation program that is targeted to each participant's particular infraction. It is not generic basic ethics education, but a focused and intense intervention that aims to provide tools of ethical analysis that each participant can apply to his or her particular situation. Run like a graduate seminar, the format is an interactive small group with 2 faculty and approximately 14 participants representing multiple healthcare disciplines. Sessions typically span a weekend and are held 12 times per year in Denver, Colorado, Newark, New Jersey, Raleigh, North Carolina, and Toronto, Ontario. This webinar will address the sessions that are held in the United States. In addition to the ProBE program, a 12-month longitudinal one-on-one mentoring program called ProBE Plus is available. Sometimes a referring entity believes that a healthcare professional might benefit from an extended period of checking in with an ethics mentor. Think of this as an ethics monitor for someone currently in practice. Only participants who have successfully completed the ProBE program are eligible to be referred to ProBE Plus. Referrals can be made to ProBE Plus at the time of the original referral to ProBE or at a later date. Details of ProBE Plus are outside the scope of this webinar, but will be provided gladly on request. The ProBE philosophy, and one of its most favorable characteristics according to attendees, is its non-judgmental tone. In an interactive setting, the faculty assist each participant to understand why a licensing board, hospital, practice partners, or professional school believed the participant's conduct merited ethics intervention and remediation. With its focus on the primacy of patient and public welfare, the ProBE program aims to restore healthcare professional ideals while achieving its objective that each participant develop a capacity to think ethically about his or her infraction. In other words, to probe into the underlying ethical issues. Categories of infractions. Healthcare professionals are referred to the ProBE program for a wide variety of infractions. Those infractions fall into 4 broad categories. Boundaries issues are represented in about 37% of all referrals. Issues of misrepresentation occur in about 30%. Financial issues occur in about 18%. And miscellaneous issues are represented among the remaining 13%. It is worth noting that not all referrals are for misconduct involving patients or clinical work. Participants can be referred for unprofessional conduct that involves colleagues, students, or family members, or even for civil and criminal violations. On the next slides, I will provide more detailed examples of the kinds of misconduct that prompt referrals to ProBE. Boundaries issues include dual relationships, such as favored treatment of friends or family, or borrowing money from a patient, sexual relationships with patients, supervisory lapses, such as allowing unlicensed individuals to render care or providing inadequate supervision, violations of patient or colleague privacy or respect, such as harassment or inappropriately accessing privileged information, and drug diversion, such as writing prescriptions for friends, family, or others who are not patients, allowing one's prescription pad to be used by others, or self-medication of addiction. Referrals for issues of misrepresentation include recalling or remembering items from board or specialty certification examinations and sharing those recalled items, lying on or omitting unfavorable information from applications for training, licensure, privileges, and the like, providing deceptive, misleading, or erroneous credentials, practicing outside one's scope of practice, and practicing without a license. Financial issues that prompt referrals include health insurance fraud, inaccurate billing, upcoding or fee splitting, kickback arrangements, billing for services not provided, performing unnecessary testing or treatment, engaging in internet drug prescribing, and making self-referrals or involvement in activities that represent a conflict of interest. Other miscellaneous reasons for referral include failure to adhere to standards of clinical practice, clinical negligence, poor record keeping, including failure to communicate with referring healthcare professionals or providing inadequate informed consent, OSHA violations, abandonment of patients, breach of patient confidentiality, impairments, either in oneself or failure to report an impaired colleague, and lapses in professional accountability, such as inadequate or untimely response to a request from a licensing board or employer, or violation of an order or directive issued by a licensing board, employer, or professional school. Here are the nuts and bolts of the program. Each ProBE seminar offers 14 contact hours spanning 2.5 days, usually over a weekend. At least 2 faculty run each session, which typically includes 14 participants. Participants are required to complete 2 written assignments prior to the session and prepare a final essay within the 2 weeks following the session. Tuition covers the 125-page syllabus, meals and refreshments during the session, and the detailed evaluation and assessment report prepared by the faculty on each participant. As with anything else, tuition is subject to change over time. Please refer to the ProBE website via the CPEP homepage for the current tuition amount. How are participants referred to the ProBE program? A referring entity, such as a licensing board, professional school, hospital, attorney, or group of practice partners, can formally refer a healthcare professional by including attendance at ProBE in a consent agreement, settlement document, or letter of concern. Alternatively, if a referring entity is unsure about whether attendance at ProBE would be helpful or appropriate for an individual, those questions can be addressed easily in a phone call. Both I, as the program director, and the ProBE staff in the CPEP office are happy to discuss general and specific questions about referrals. I can assure you that all information shared is held in the strictest of confidence. ProBE and CPEP personnel are accustomed to dealing with sensitive issues. We hold ourselves to the same standard of respect for confidentiality that is expected in healthcare. Once the referral is made, the participant logs onto the ProBE website from the CPEP homepage and completes the online registration process. Certain documentation of the reason for referral is necessary so the faculty can prepare in advance to teach the individuals attending each session. This documentation should represent a third-party statement of the infraction or concern about the referred individual. Documents such as a consent agreement, legal settlement, or letter of concern will suffice. Participants are expected to prepare prior to attending a ProBE session. There are 2 written assignments. The first is a description of an ideal healthcare professional written in the form of a letter of recommendation for or advice to a prospective student in the participant's profession. The second is a written statement of the reason or reasons for the individual's referral to the PRO program, including how the misconduct came to the attention of the referring entity, how the referring entity perceived the misconduct, and what sanctions were imposed. Finally, each participant is expected to review the syllabus carefully prior to the session. The PRO curriculum at each session covers the following 7 modules. In the Ideal Healthcare Professional module, participants and faculty engage in an exercise that makes use of that first written assignment prepared by participants in advance of the session. In the second module, participants read their prepared stories of infractions and sanctions. Each participant is expected to disclose his or her reason for referral fully and honestly. This open disclosure is a critical step in the remediation process and is only possible in the non-judgmental and trusting environment that is the hallmark of the PRO program. 2 modules cover clinician-patient relationships. The first, pertaining to models of clinical care, covers issues such as power in healthcare relationships and the effect of burnout, anger, and stress. The second, pertaining to boundary issues, covers both the slippery slope and the graded risk models of boundary crossing. These 2 distinct models take context into account and allow for a nuanced understanding of boundaries in healthcare. 2 modules address accountability in healthcare. The first pertains to accountability within the medical professions and involves the study of professional codes of conduct and oaths. The second describes the complex system of accountability in healthcare that exists in contemporary society. Finally, the last module provides ethical frameworks that can be used as intellectual tools of analysis when the participants examine their own situations from an ethical perspective. The final essay. After the conclusion of each session, participants are expected to write a final essay that employs what they learned in the session. We ask them to analyze their infraction as if it were an ethics case. By explaining why the referring entity should care about their misconduct and using syllabus materials and other components of the course, participants should be able to demonstrate a capacity to think ethically about their reason for referral to the PRO program. The final essay is due 2 weeks after the session. Referring entities will receive a copy of these final essays. The Evaluation and Assessment Report. After receipt of the final essays, session faculty compose a detailed evaluation and assessment report for each participant. This report has 3 components. First, a description of how the participant performed in the session. Faculty comment on level of engagement and participation, the recitation of the infraction and sanctions, and any other relevant aspects of participation. Second, a critique of the final essay. This includes a general summary of the analytic tools and curriculum materials the participant used in his or her analysis, and a detailed commentary on the quality of analysis. Third, an overall evaluation of the participant's capacity for thinking ethically about his or her infraction. In other words, this is the participant's final grade in the PRO program. The evaluation and assessment report is completed 2 weeks after receipt of the final essays or 4 weeks after the session itself. Referring entities and participants themselves receive a copy of the evaluation and assessment report. Evaluation at completion. Each participant can earn one of 3 possible final grades. First is unconditional pass, which is earned by those participants who have demonstrated a capacity to think ethically about their infraction. Roughly 84% of PRO participants receive this grade. Next is conditional pass, which is earned by those participants who demonstrate only partial comprehension of the ethical issues involved in their misconduct, or who demonstrate partial involvement in the process of the session. Remember that our course is named PROBE. For those who demonstrate only partial probing into their relevant professional ethical issues, the faculty will try to make suggestions to referring entities about additional interventions or resources that may be appropriate. Approximately 11% of participants received this conditional passing grade. Finally, approximately 5% of probe participants failed. Those individuals typically demonstrate limited capacity to think ethically about their infractions, or limited concern for the ethical and social obligations of the medical profession. In some cases, repeating the ProBE program is appropriate and extremely helpful. As program director, I am happy to speak with referring entities about whether repeating ProBE would be advisable. I hope this introduction to the ProBE program has been helpful and informative. You may wish to consult our website at cpepdoc.org/probe for additional information. And I am always happy to discuss general and specific issues with referring entities. Thank you very much for your time, attention, and interest in the ProBE program.